My name is Uma Kolem-Parimbal. I'm the head of School of Economics and Finance at the Wits University. It is my pleasure and privilege today to welcome each of you to this webinar on the economic and social impact of COVID-19 in Southern Africa region. As we speak, the pandemic is evolving and the region is in the eye of the storm. While the long-term impact of the pandemic is yet to be clear to any of us, the webinar today will give us insights into the short and medium-term impact that the region of Southern Africa has seen over the last 2 years. And this is crucial to put in place policy interventions that can see the region come out through this crisis with as low damage as possible. My role today here is that of the chair. And to begin the proceedings, I would like to invite Professor Imran Valodia to give us an introduction of the research project. Imran, of course, needs no introduction. He is the Dean of Faculty of Commerce, Law and Management and the Director of Southern Center of Inequality Studies. Over to you, Imran.
Great, Uma. Thank you. Thank you so much for the kind introduction. I'm not going to be too long because I think what you kind of really want to hear is the results from the papers that have been done. But I thought it might be kind of useful for me to just share with you some of the kind of objectives that we had in kind of setting up the Southern Center for Inequality Studies, and how this particular project, I think, fits within that. So when we made the decision to kind of embark on the establishment of a kind of research center on kind of inequality, we wanted, among other things, and I think this is kind of reflected in the name, to do a lot more kind of cross-country studies of issues of inequality in the global South. Because our kind of argument here is that the kind of issues of inequality are felt most in a most pronounced way in countries in the global South, the way where kind of inequalities are most kind of extreme, but that the sort of locus for kind of research was essentially in institutions in the global North, and that we wanted to break the fact that our relationships to other countries in the global South were being kind of articulated through countries and kind of institutions in the global North. So it's kind of really pleasing that we can have a seminar of this sort where we're sharing kind of results from kind of research that's been done in a number of Southern African countries that kind of assesses some of the socio-economic kind of impacts of the pandemic. Another important objective that we had was to kind of generate opportunities for kind of postgraduate students, and as you'll hear from the colleagues that present the papers, that we've managed to create some exciting opportunities for a number of our postgraduate students in this project. The third objective we kind of had was for the center to kind of assist other parts of the university and kind of schools inside our university to be able to kind of access funding, and for us to through the center to provide support for that research. And I think this kind of project, which is managed kind of inside the kind of Southern Center for Inequality Studies, that is essentially a partnership between the center and the school that creates opportunities for colleagues kind of in the school to kind of embark on kind of new research, and to support for the center to support that research through kind of providing the financial resources that are needed. So kind of again, I think it's a sort of demonstration of the potential that we have to kind of grow these sorts of collaborations within our own institution. So the papers that we have today really kind of draw on the research that's been done. We're seeing this seminar as kind of essentially a seminar for us to get some feedback, if you like, from the research community, kind of inside the VIT system and kind of outside. And there'll be a number of follow-on events where we'll kind of engage a lot more kind of closely with policy makers across the countries where the work has been done. So with that, let me then welcome everyone to the seminar. Kind of looking forward to hearing from the kind of presenters. And with that, I'll pass it back on to Uma.
Thank you, Imran, for that introductions. So before we get started with the presentation, a few housekeeping rules to remember. So while the presentations are made, the participants will be muted. If there are any pressing questions that cannot wait till the Q&A session, I urge you to put it on the chat, and then I can communicate it to the presenters. Additionally, I would request everybody to keep your videos off unless you're presenting. And now we go straight into the presentations. For the first, I would like to invite Ibra Seninde to provide the setting and the context for the 3 Southern African country studies. Ibra is a PhD candidate at the School of Economics and Finance and works in the area of health economics. Over to you, Ibra.
Good day, everyone. Thank you for joining us for this webinar. And once again, my name is Ibra Seninde, and I'm going to give brief context to the developments of the pandemic, the restrictions, and the lockdowns across all the 3 countries. Share my screen. Can everyone see my screen?
Yes, it's visible.
To begin with, globally, according to the World Health Organization, so far the total number of confirmed cases across the globe have surpassed over 250 million confirmed cases, and the total number of confirmed deaths attributed to the COVID-19 pandemic have also exceeded 5 million across the globe. In terms of cross-country comparison, we're talking about South Africa, Malawi, and Zambia. we can see that the impact, in terms of impact of ever since the pandemic started, the impact has been more severe in South Africa, and that's the red line, if you can see on the graph. The impact has been more severe in South Africa compared to the other two countries, that's Malawi and Zambia. We can see that in terms of new confirmed cases, South Africa has had a surge in the number of COVID-19 cases in a round of 3 waves. And we can see that the first wave started during around the period of July 2020. And the second wave, which was more severe than the first wave, happened during the period of between December 2020 and February, the year of 2021. The third wave, which was quite similar in terms of magnitude, happened during the period of June to July or September during the year 2021. When we look at Malawi and Zambia, the impact of the pandemic hasn't really been that severe as compared to South Africa, but maybe this can be attributed to maybe the underreporting of cases. But even if, nevertheless, still South Africa still ranks high in terms of confirmed cases. A similar trend has been witnessed in terms of the deaths registered by each country. And we can still see that we have all the 3 countries, across all the 3 countries, that at a peak 3 rounds of waves have been registered, and they happened concurrently with the surging number of cases. But still, as the graph indicates, we can still see that South Africa still suffered more severe consequences compared to both Malawi and Zambia. Following the first incidences of the pandemic, definitely countries had to put in place restrictions so that they can curb the effects and the severe impacts of the pandemic. If we begin with, just want to remove this. So if we begin with South Africa, we can see that South Africa actually confirmed its first positive case earlier than any of the 2 countries, that's Malawi and Zambia. And this was on the 5th March. And after confirming its first case, it declared its first lockdown, a full lockdown. It announces a full lockdown on the 27th of March. So this came with a couple of measures. That includes a closure of schools, closure of entertainment centers, and restrictions on business and travel. So South Africa, we can see that South Africa confirmed its first death on the 27th. And ever since then, we can see that a couple of restrictions have been put in place, but the first gradual easing and phased easing of the restrictions happened on the 1st May. So we can, as of the 26th November, we can see that the country is on adjusted level 1 of the lockdown. And with this, we can see that the travel is allowed, but with restrictions, economic activity is open, schools are also open, same as entertainment centers, but with restrictions. If we move on to Malawi, the case for Malawi was quite different in that for them, the Malawian government declared it identified its first COVID-19 case, 3 positive cases on the 2nd of April. That came a period later compared to South Africa. However, even after confirming the cases or identifying the first 3 positive cases, Malawi never went into a full lockdown. In as much as government had declared a full lockdown, this was actually contested in court, and the Malawian court actually suspended the implementation of the proposed 21-day lockdown. So instead, a partial lockdown was actually declared by the government. However, this still did not stop Malawi from implementing a full lockdown. as the surge in cases happened during the beginning of 2021, the year 2021 in January. So this is when Malawi implemented its first full lockdown, as we can see here. So ever since then, Malawi has also had a phased lifting of the restrictions. And as of 26th November, we can see that Malawi is on a partial lockdown, travel is operational, and economic activities also open. The same applies to schools, also entertainment centers, but with restrictions. Lastly, we can see that Zambia declared a full lockdown even before they actually registered any positive case. And this was on the 17th of March on the 2020. And they identified their first case just the following day after declaring the lockdown, and that was on the 8th. Zambia also recorded its first death on the 2nd of April, quite between the same period as Malawi, but quite later compared to South Africa. Zambia first eased its lockdown restrictions on the 8th May. That came during the same period as South Africa. And as we can see, as of 26th November, Zambia is also on a partial lockdown, and we can see that travel is allowed. Events are also partially allowed, and economic activities open, with entertainment centers open with restrictions. Overall, we can see that in terms of magnitude, the relative numbers show that in Africa has registered a total number of 8.6 million COVID-19 cases. And we can also see that they have registered over 200 COVID-19 deaths. In terms of ranking, South Africa ranks higher compared to both Malawi and Zambia, because South Africa has the highest number of confirmed cases, which exceed over 2 million confirmed cases, same and 89,000 deaths. This is followed by Zambia, which actually has registered over 210 confirmed COVID-19 cases, with over 3,000 COVID-19 deaths. Malawi ranks relatively lower than the other compared to both South Africa and Zambia, with 61,000 cases and 2,304 cumulative deaths recorded. In overall, we can see that among the three countries, South Africa, Zambia, and Malawi, the pandemic has really been much more severe in South Africa, with South Africa registering the highest surge across all the 3 rounds and waves of the pandemic. I thank you.
Thank you, Ibra, for that very organized presentation of the progress of COVID and response to COVID in the 3 Southern African countries. So we now progress to the country-specific presentation. And for the first, on Malawi, I would like to invite Professor Miracle Benhura. Miracle is an associate professor in economics at the School of Economics and Finance. Over to you, Miracle.
Good afternoon, everyone, and thank you, Uma. I'm just trying to share my screen here. Okay. Yeah. So I'm going to be exploring changes in household food insecurity in Malawi during the COVID-19 pandemic. So in terms of the introduction, We're saying the lockdown regulations of the first quarter of 2020 disrupted household income and household production, such that some workers lost jobs and sources of livelihood, while some farm and non-farm enterprises lost access to the market. And this worsened the burden of food insecurity among households in poor countries such as Malawi, which disproportionately suffered from this challenge before COVID. However, it is expected that household food insecurity could have been declining over time due to social assistance and development of household coping mechanisms during the pandemic. So this study aims to investigate changes in prevalence and determinants of household food insecurity in the COVID era in order to inform counter strategies. The data used for the study comes from the HFPS, which is the Malawi High Frequency Phone Survey on COVID, which was launched in May 2020 by the National Statistical Office with support from the World Bank. So the HFPS is a monthly survey of a nationally representative sample of households to monitor the economic impact of the pandemic and other shocks. At the moment, 11 waves of the survey have been collected with dates ranging from May-June 2020 to May-June 2021. But our sample of analysis here is selected from months or waves that have information required for the analysis. And we've got about 12,813 households across all the survey months. Of interest in the HFPS is a module which captures a food insecurity experience scale based on 8 questions. So the questions have a reference period of 30 days, and they aim to capture whether the respondent or other adult household members were worried that they would not have enough to eat, or they were unable to eat healthy and nutritious food, or they ate only a few kinds of foods, or they had to skip a meal, or they ate less than what they thought they should, or they ran out of food, or they were hungry but did not eat, or they went without eating for a whole day. So on the basis of these questions, we are going to estimate the prevalence of moderate or severe food insecurity and how it changes over time. In terms of the methodology, we firstly utilize the food insecurity experience scale to measure household food insecurity. And this is a widely used metric of food insecurity within and across the world. The estimation procedure can be found in the FAO and associated program, which is the Voice of the Voices documentation. In brief, the rationale and data analytical steps follow the item response theory, which emphasizes on measuring latent traits through analysis of responses to survey. The analysis of FIES data involves parameter estimation, statistical validation, and calculation of prevalence estimates of food insecurity based on responses to the 8 questions already mentioned. So to implement the food insecurity experience scale, we utilize an app that has been developed by the Food and Agriculture Organization, which is known as the FIES Shiny app. For our analysis, we carry out a pooled analysis for households across all the waves. So the reason why we pull the analysis is because we were using the same weights for the 8 FIES components, which allows comparing prevalence of household food insecurity across time periods. And second, we also estimate a Logit model to explore the determinants of household food insecurity. So here I just want to note that the Logit model is estimated separately for each wave, that way we've got data. The reason why we estimate the separate Logit model is because the output that we get from the FIES app does not give us a unique household identifier for each wave, such that we cannot possibly construct a panel. And also, we couldn't estimate a multinomial Logit model because the proportion of households that are severely food insecure is very small in some waves. So I'm going to talk briefly about the descriptive statistics for household food insecurity experiences. So here, these are the 8 questions that I've highlighted before. What is evident is that as the question captures low severity of food insecurity, find that there is a high proportion of households that are affirmed to food insecurity. So for instance, in May, June 2020, 71% of households were worried that they won't have enough food. And at the same time, 34% were worried that they went without food for the whole day. And as we move across periods, we find that the proportion of households that incurred food insecurity did not show a steady decline, but it's only over time that we can see a statistically significant decline. For instance, in May, June 2021, 41% of households reported that they were worried that they won't have enough food. And 12% were worried that they would go for the whole day without eating. Now I'm just going to talk about descriptive statistics for some of the variables that we are including in the Logit models. And we find that there are a few households that have got heads aged between 16 and 26 years, like 7% across the months that we are looking at. So the household characteristics are pretty stable across time, which is expected. And also a lot of households, like 28 to 30%, are headed by individuals aged between 37 and 46 years. And for the households, you also find that 23 to 27% are female headed. And the household size is about 5, whereby 2 is the number of children and 3 is the number of adults. And close to 70% of the household heads are married. When it comes to region, Malawi has got the north, the central, and the southern region, and most of the households are located in the southern region, which is the poorest region of the country, that is characterized by matrilineal kinship, whereby, say, land is owned by the maternal side of the family, and it is passed on to daughters. And in these southern households, they mostly have low socioeconomic status and small land parcels. On the contrary, the central region is the richest one, which comprises mostly of patrilineal kinship. And they've got large land sizes and low poverty. And the northern region falls in between the central and the southern in terms of welfare. And also we've got about 20% of households that are urban. And we also have income loss variables, whereby a household was asked if they incurred reduced income from the previous month. So it happens that we are capturing income loss from wages and income loss from non-farm enterprises, income loss from farming, livestock, and fishery activities. as well as total income loss. So, for instance, if you are looking at total loss, in May-June 2020, about 80% of households reported that they had reduced income. And in May-June 2021, this decreased to 44% of the households. Now I'm looking at the results for prevalence of household food insecurity, where we are reporting here the prevalence, which is the percentage of food insecure households, and the margin of error, as well as the confidence interval for moderate or severe food insecurity, and also that for severe insecurity. So we find that if you are looking at moderate or severe, which is just households that had insecurity, in May-June 2020, they were 72.6%, and the figure remained statistically significant, statistically similar in July 2020, as well as August 2020. A statistical decline was evident in October, November 2020, which is about 10 percentage points. Since then, another statistical significant decrease was evident in May, June 2021, which means that it takes about 6 months for food insecurity to decrease, although the level is still high at 47.95% as of May, June 2021. If we look at severe food insecurity, in May, June 2020, it was around 29% of households, and the figure was statistically similar across the other months, only to decrease in April 2021. So this shows that severe food insecurity lags moderate or severe insecurity in terms of the rate of decrease. Now I'm moving on to the results for the Logit models. Here, just showing the marginal effects. What I have in purple here are the statistically significant coefficients. So I find that if we are looking at gender, female-headed households were 8% more likely to be food insecure in May, June 2020, and 16% more likely to be insecure in August 2020. Thereafter, the likelihood of food insecurity is of the same order between female and male-headed households. And for marital status, households headed by married individuals were 9% less likely to be food insecure in May, June 2020, compared to those with unmarried heads. But thereafter, the effect is statistically similar. When it comes to age of the household head, it is mostly insignificant, but where significant, we find that households headed by individuals aged, say, from 37 to 56 years were less likely to be food insecure compared to those headed by individuals aged from 16 to 26 years. Then also household composition variables were significant. They are telling us that a number of children, for instance, it increases the likelihood of food insecurity. So a unit increase in the number of children increases food insecurity by about 4%. And a similar result is also shown for the number of adults. When it comes to geographic regions, we find that households in the southern region were more likely to be food insecure than those in the central region by between 8 and 10% were significant. So here I want to highlight that the effect was of the same order in May, June 2020 and May, June 2021. Part of the reason is that the agricultural season in Malawi spans from November to April, and these households in the southern region have small land parcels and they are poor. So it could be that in May, June, this is immediately after the harvest period, so they still have something to eat. But thereafter, they don't have a lot of spared food. That's why they immediately become food insecure. Now, all households in urban areas are less likely to be food insecure compared to those in rural areas. And also, when a consistent finding that we have here is that households that had reduced income from farming activities were consistently likely to be food insecure compared to others. Although the percentage of being more food insecure is not showing a consistent change over time, but the stories that across the given months, households that lost income from agriculture activities were 11 to 18% more likely to be food insecure than others. This is linked to the economic structure of Malawi, where agriculture contributes about 30% of the economy. And also we find that wage income is also important. Households that said reduced wage income due to direct or indirect effects of COVID-19 also incurred high food insecurity. But we also have here kind of a puzzling outcome that households that lost non-farm income were less likely to be food insecure. So I don't understand the reason here. I need to dig deep to get a better understanding of that. So those are the results. Now I'm going to look at the implication of the results. Yes?
I hate to interrupt you now. But we need to speed up a little bit. I can give you 5 minutes extra.
Oh, okay, thanks. So I'm just looking at the implication of the results. So I'm saying household food insecurity in Malawi remains high during the global pandemic. Recovery is a long rather than a short-term process. And also, while current interventions have led to a temporal decrease in food insecurity, more interventions are required in rural compared to urban areas. Also, interventions need to be sensitive that households in the southern region are at a higher risk than those in central and northern regions. So the result on gender, I'm tentatively here saying that it's suggesting that the interventions should be a bit gender blind, because that female-headed households were worse off during the onset of the pandemic, but they appeared to have caught up with the male-headed households, although the underlying mechanism requires further investigation. So importantly, our study recommends mitigatory measures for reduced household income from agriculture and wage employment. So this can include, say, social security relief or direct interventions along the agriculture value chain. So last but not least, our results here should be taken as being indicative due to some limitations. For instance, we couldn't control for unobservable characteristics that influence household food insecurity, and the household head's education level, which is an important indicator of socioeconomic status. So this follows in some inconsistencies in the way the education variable is captured, which is difficult to reconcile across waves. So thank you for listening.
Thank you, Miracle. I don't see any questions posed on the chat. I believe participants are holding it for the Q&A session. So now I invite Dr. Laura Rousseau to present on hunger and socioeconomic vulnerability in South Africa. Laura Rousseau is a senior lecturer in the School of Economics and Finance. Over to you, Laura.
Thanks, Uma. I'm just sharing my screen. Uma, can you see my screen?
Yes, visible.
Great. Thank you so much for the opportunity to present this work, and good afternoon, all the colleagues. So I'll be presenting on this report that we did on measuring some of the socioeconomic consequences of the COVID-19 pandemic in South Africa. But today I'm really going to be talking only about one of the relationships, focusing on hunger and socioeconomic vulnerability. So the data we used for the study was the Gauteng City Region Observatory Quality of Life surveys. There are 6 surveys stretching between 2009 and 2020 and 2021. So really, when we say South Africa for this study, particularly, we just focus on the Gauteng province. And in this final survey, the final quality of life survey, there were very useful questions, asking questions particularly about COVID-19 and the impact of COVID-19. And we drew on these variables a lot as well. So just going forward, some of the definitions, when I'm talking about adult hunger, the question asked to respondents in the survey was asked as, in the last year, has there ever been a time you or any adult in this household had to skip a meal because there was not enough money to buy food? And child hunger was asked, child hunger was captured using the variable asked to respondents as, in the last year, has there been a time when you did not have enough money to feed the children in the household? And this question was only asked to or answered by respondents with children in the household. And then when I refer to the SRD grants, I'm referring to the Social Relief of Distress grant that was distributed to South Africans or persons in South Africa starting in May 2020, which amounted to about 350 Rand per year, per month. And respondent and people that were eligible for the grant were people with who were not receiving any other form of income, so no grant, no other form of a grant or other forms of income, and those that were unemployed. And here we distinguish between several categories. We distinguish between those that applied for the grant and received it. Hang on a second, see if I can use this laser pointer. Those applied for the grant, those who received it, and those who applied for the grant and did not receive it. And then, of course, those that did not apply at all. And then for the methodology, we used mostly just descriptive statistics, given the cross-sectional nature of the data. And we confirmed these relationships using multivariate analysis. And I'm going to be skipping a lot of the methodology and just dive straight into the results, because there was quite a lot of results to get through. So in the interest of time, but you can draw on the full report to learn more about the methodology. So overall, between 2009 and 2021, we see that adult and child hunger became progressively worse in Gauteng. And we see that this is particularly true for poorer households, where a household was defined as poor when they fell into the bottom 3 wealth quintiles, asset wealth quintiles. And we see that in 2021, adult hunger amongst poor households was classified at 34%, and amongst child hunger amongst poor households was 28%. And when we did a more in-depth analysis of what these hunger levels look like across specific subgroups, we found that the increase in hunger was largely driven by the increase in hunger among Black, African, and colored households. And we also saw that respondents that were female were more likely to report that there was hunger in their household compared to male respondents. So in the final wave of the most recent wave of the GCRO Quality of Life Survey, they asked respondents whether they had experienced any of the following socioeconomic shocks since March 2020. Excuse me. So they asked respondents, have you, sorry. Have you spent more time than usual looking after children or other family members? To which 28% said yes. So there was a massive increase in the care burden. Whether people had experienced a salary and working hour reduction, to which almost 1 in 5 respondents said yes. Had they lost a job, to which almost 11.4% of respondents said yes. 4.5% of respondents had to close a business permanently, and 0.4% of respondents were evicted from their homes. We then created a socioeconomic shock index variable using these indicators, and we obviously observed it across different groups. And interestingly, what we show here on the right is that the socioeconomic shock variable, which is a binary variable equal to 1 if you experience at least one socioeconomic shock, and we find that there was very little variation across the various income groups when it came to experience a socioeconomic shock. Of course, this might be a sort of a selection criteria or selection bias where, for instance, if you have a job to lose, you're more likely or more probable to lose a job. But we do see that amongst households, that hunger, adult and child hunger, was higher amongst households that experienced a socioeconomic shock. So here, using this confidence interval plot, this indicates our level of adult hunger, and at this point is our level of child hunger. And we differentiate between those that had no shocks and at least one socioeconomic shock. And we could see that adult and child hunger was statistically significantly higher amongst those that experienced at least one socioeconomic shock over this period of time. And although I don't show it here, we also see that poor mental health was highly correlated to levels of adult and child hunger. But looking only at the descriptive statistics, we do see some evidence that the social relief and distress grant was well targeted at food insecure households. So here, once again, we differentiate between child and adult and child hunger, and we distinguish between those that did not receive the SRD grant and those that did receive the SRD grant. And looking at the overall population, those that received the grant, and so applied and received the grant, had slightly higher levels of adult and child hunger compared to the rest of the population who did not receive a grant. And this corroborates what we see from some of the NITS CRAM studies, which have shown that the SRD grant and the child support grant top-ups seems to have been relatively well targeted towards food insecure households. However, we do see a potentially vulnerable group that was left out. And this we can only say using the descriptive statistics. So in this figure on the left, we looked at only respondents who had applied for the SRD grant. And we distinguish between those that applied and did not receive it on the left and those that applied but did receive the grant. And we see that there is a group of people who applied and did not receive the grant who are reporting higher levels of adult and child hunger compared to those that did apply and receive the grant. And of course, we are unable to see, due to some difficulty with the data, whether or not this group were actually receiving the child support grant. But we have seen sort of widespread reports that some of the targeting of the SRD grant were based on slightly outdated databases. And of course, we can't say that this is what it is, but it might be the case that this is what we're observing, is that there is this potentially vulnerable group that is not or was not during the time of the survey receiving the necessary support. In the data, respondents were also asked whether during the lockdown period, whether they kept their children away from school, even though they were allowed to return to school. Right, so we were able to distinguish between people who kept their children at home and those who did not, even though they were allowed to go to school. And the figure on the left shows the level of child hunger distinguishing between those that were kept away from school and those that were not kept away from school. And we see a slightly higher level of child hunger amongst those that were kept away from school compared to those that weren't. And then on the figure on the right, though, we control for those who were recipients of the school feeding program. So when we only look at students who were recipients of the school feeding program, we see that, yes, there are overall higher levels of child hunger, as we would suspect, because this would be the group that would be, they would be more inclined to be in the lower wealth quintiles. But we see the difference between those who were kept away from schools and those that weren't kept away from schools dissipating. And so we know in various provinces, school feeding programs adapted, and we know that this was the case in Gauteng, where school feeding programs shifted towards food parcel systems to ensure that households were still receiving food. And so this might be some indication that this was actually successful. Then in order to gauge, we looked at dynamics within the household to see how households may have actually responded to food shortages during the COVID pandemic. And to this end, we only focus on households with children. And we distinguish between the year, what happened to hunger between 2018, so pre-pandemic, and what happened to hunger in 2020 and 21, so during the process of the pandemic. And we see that in households with children and adults, adult hunger increased slightly from 22% to 25%. But within these households, child hunger decreased slightly. I mean, slightly, you can almost say it stayed the same, from 21% to 20%. And we also see that that in most households, both adults and children experience hunger. So these are households where they were both adult and child hunger at the same time. But when we look at households where there are adults and children, but only the adults went hungry, we see a slight increase in adult hunger from 4.6% to 7.6%. And when we look at households where an adult and a child was present, but only a child went hungry, we see a slight decrease in child hunger. And so what we might be seeing here is something that was also reported by Van der Bergshuizen and Bridgman in their analysis of the NITS Crown results, which showed that adults, to some effect, in the beginning of the pandemic, shielded child hunger by shielded the effects of child hunger. But the authors in that report also say that this is not a sustainable solution, because at some point savings and support systems start drying out as well. But this might be a similar trend that we're spotting in the GCRO data. Right, so just to summarize the findings briefly, adult and child hunger are still really pervasive and persistent in Gauteng households. But we do see evidence that the SRD grant and the school feeding systems might have been quite well targeted to reaching these households. But there is the possibility, and something that requires further analysis, that there was a small group of people who were not eligible for the grant for some reason and were quite vulnerable during the process and might still continue to be vulnerable. If you have any further questions, please don't hesitate to email me directly, and I'm sure at some point the full report will be made available. Okay, thank you.
Thanks, Laura, and thank you for keeping the time. I don't see any questions. Once again, I hope that they're all being reserved for the Q&A session. So next we move to firm performance and survival under the COVID pandemic, with evidence from Zambia being presented by Dr. Ediola Oyenobi. Ediola is a senior lecturer at the School of Economics and Finance. Over to you, Ediola.
Thank you very much, Uma. So good afternoon, everyone. Thank you for the opportunity to present. I will be talking about the effects of the pandemic from the firm side, or the effects we're seeing in terms of hunger. Some of them may actually come from the loss of jobs. So this paper is going to be looking at the gender dimension in terms of the impact of the pandemic on firms, the impact of the pandemic on firm performance, and then survival. So like I said, the aim is to investigate the impact of the pandemic on firms in terms of their survival performance and to look at some gendered effects. The premise is that we expect that the COVID-induced labor market shock might have differential effects on firms depending on, and workers depending on their characteristics. We're going to be using the Zambian version of the World Bank Enterprise Survey. Just to give you a summary of the results, we find that there are gendered effects where females are affected in terms, disproportionately affected in terms of job loss, and informal workers too are disproportionately affected in terms of job loss. We found that firms that are at least partly owned by females, so from the ownership point of view, firms that are owned by female are disproportionately affected in terms of survival. And then we find that firms that use digital channels before the pandemic hit are more likely to survive. We also found out why reacting to COVID shock by adjusting production process increased the probability of survival is actually correlated with less sales during the pandemic. Lastly, we found that stronger firms in terms of their sales in the previous year are more likely to survive. So just to give a brief description of the data set. We use the World Bank Enterprise Survey. The World Bank conducts this survey regularly, not every year, in different countries. Luckily, there was one survey that was conducted between September 2019 and March 2020, which was just before the pandemic hit in Zambia. And there was a follow-up survey, which was actually a phone survey that followed up the firms that were interviewed in the previous survey that was conducted between June 6th and 17th July 2020. So we exploit the fact that these surveys are only a couple of months apart and they happen on either side of the pandemic, that is just before the pandemic hit and after the pandemic was fully on course. And we have a 96% response rate. So the attrition is about 4%. A total of 601 firms were interviewed over the 2 waves. Find that about 1/3 of the firms that were interviewed in 2019 in the first wave survived when they were called back in the second time around. The covariates included in the analysis are sector, firm size, region, legal status of the firm, the age of the firm, the sales, last year's sales of the firm, the export status of the firm, access to bank loan, use of mobile money, percentage of female owners in the ownership structure of the firm, sector experience of the manager, and the manager's gender. All these covariates are sourced from the baseline data. We also included a covariate from the endline data, which asks firms whether they were able to adjust their production to cope with the COVID situation. So the analysis can be broken down into 5 parts. We explore job loss, comparing temporary workers with permanent workers, or temporary or informal workers with permanent workers. We consider the probability of survival, sales, conditional on survival, correlates of job loss between doing the analysis for permanent workers and temporary workers separately. And then lastly, we consider under the conditional independent assumption, the causal effect of female ownership on firm survival. So the results, in terms of job loss, 42% of the firms reported a decrease in the number of temporary workers, while only 30% of the firms reported a decrease in the number of permanent workers. That obviously shows that firms found it easier to lay off temporary workers compared to permanent workers. The same result hold when the analysis is disaggregated by female ownership. Firms that were partly owned by females are 10% more likely to report a decrease in the number of temporary workers compared to the decrease in the number of permanent workers. The substantive result also remains valid. The details are in the report when the analysis is broken down by firm size and sector. So consistently, we find that temporary workers, firms report that they are likely to lay off temporary workers more than they are to lay off permanent workers. In terms of probability of staying open in the second set of interview, that is surviving, we find that sector matters. Those who are in wholesale or agricultural input and equipment sector are 19% more likely to survive. Location also matters. The firms in Livingstone are 12% more likely to survive. The firm's age also matters. Older firms are more likely to survive, and being able to adjust production for the pandemic situation also increases the probability of survival. In terms of the probability of staying open at follow-up, being owned by having females in the ownership structure of the firm actually decreases the probability of staying open for the second interview. So firms that are partly owned by females are 9% less likely to survive at follow-up. In terms of the firm sales, conditional on staying open, so this analysis is restricted to those firms that say they are still in operation in the follow-up survey. We find that location matters. Those who are located in Lusaka, being in Lusaka reduces the probability of reporting a decrease in sales, while being able to adjust production for COVID increases the probability of reporting a reduced sales. And this is important. So what is suggesting there is that while being able to have a ad hoc plan to adjust your production process because of COVID, while it increases the probability of survival, it actually reduces the sales, at least in the short run. In terms of the covariates that are correlated with decrease in the number of workers by employment type, we find that for those who are temporarily employed or those who are informally employed, sector matters. Those who are in other services are more likely to lose their job. Those who work in larger firms are also more likely to lose their job. Those in Livingstone are more likely to lose their job. And having a female as a top manager also increases the probability of experiencing decrease in the number of temporary workers. Lastly, being able to adjust production for COVID also increases the probability of losing temporary workers during this period. While for workers that are permanently employed, the factors that are important in terms of decrease in number of workers that are permanently employed includes location. Those who are in Livingstones are more likely to lay off permanent workers. The use of mobile money as a means of doing business also increases the probability of laying off permanent workers, and being able to adjust production for COVID also has the same effect. Okay, so lastly, we find that the results, all the results I've gone through so far, still hold true, especially the result on female ownership when we control for selection using the conditional independent assumption. For that analysis, I used the entropy balancing method and found that those firms that are more than 50% ownership by female owners are more likely not to survive the pandemic. So that result is robust to that additional analysis. So the implications are that gender and informality play a role in terms of the negative impact of the pandemic on the labor market in Zambia. This implies that those who are vulnerable before the shock, which are typically female workers and those who work in the informal economy, are disproportionately affected in terms of job loss. It appears that the key factor is informality, because there are reports that also show that female workers are more likely to work in the informal sector. Second, farm survival depends on preparedness before the pandemic. So farms that are stronger, that is as measured by sales in the last period, are more likely to survive. Farms that already have digital channels in place before the pandemic hits are more likely to survive the pandemic, because then they can, probably because they can then simply shift their sales processes to online mode. Lastly, we find out being able to adjust or react to the pandemic condition, while that is likely to increase the probability of survival, it actually has a negative effect on sales. So that's just the summary of the result.
Thank you, Adiola. Next, we move on to presentation by Professor Frikkie Boysen on the theme of socioeconomic responses to COVID-19. Professor Boysen is a professor in health economics at the School of Economics and Finance. He's also the lead PI of this research project. Over to you, Frikkie.
Thank you, Uma. Can everyone see my presentation?
Visible, Frikkie.
Thank you. I'm going to do something very different compared to the previous speakers and reflect on inequality and responses to the pandemic, and ask more questions than I have answers for. Sorry, I can't move my slide. Sorry, everyone. My arrow keys are not working. They're working now.
No problem, Frikkie.
Okay, we've already heard about lockdowns and the huge impact lockdowns have had on the economies of most of the countries in the world, including the developing countries. And that is just, once again, another representation of lockdowns, including hard lockdowns across the African continent. There's very little synthesis so far on the economic impact of COVID-19. This review by Brodeur and his co-authors is one of very few. And if you read the review, a large part of the review is about evaluations or impacts of health-related interventions rather than social or economic responses. And here you'll see that publications by the NBER sort of follows the epidemic trend, it seems. This is just an illustration of the economic shocks we've seen in these three countries, both in terms of GDP and on the two left diagrams, as well as fiscally, where we saw increases in public debt as a result of the packages and aid that these countries had to institute. And we also saw, and there's very little cross-country analysis that allows us to separate these three countries. This is from the Africa Economic Outlook that just predicts how the number of people in extreme poverty will actually rise over this period. And we're talking about 30, 40 million people that will be pushed into poverty. One lens that allows one to look at responses and policy responses is the UN's framework of policy responses. There are 5 pillars. It's health, firstly, health responses. It's social protection and basic services. Economic response and recovery, the third one here you'll see is mainly about supporting small and medium enterprise and the informal sector. There are, of course, fourthly, macroeconomic responses. And then in the fifth instance, there's a focus on social cohesion and community resilience. And in terms of what is published or what is known, we could really find very little on this specific dimension of the policy response. Across the UN countries that were supported during the pandemic, you will see that a fair number of them, or a fair share, implemented these types of interventions. The policy framework also has 2 cross-cutting issues called green recovery and gender inequality, and those also featured in some of these responses. So there's been a lot of response, there's been multifaceted response, there's been multi-sectorial response. And the alignment with these responses has been relatively high. You'll see it's 70–80%, except at the macroeconomic level. But at the health, protecting people, and economic response recovery level, alignment of countries' policies has been relatively well. What I want to do, however, is to reflect on how we think about the impact of these policies. In our desktop review of responses in these 3 countries, what we were clearly struck by is the evidence, the absence of evidence of the impact of interventions. And we need to think how we're going to think about these effects of interventions going forward. And one framework that is useful to do this is the so-called framework to look at adverse effects of public health interventions, which has 5 components, of which equity is one. And this framework looks at effects as harmful effects. And I would like to think that we should also take the same lens to look at benefits and where benefits accrue. Some of you may be familiar with the so-called Progress Plus framework. So the Progress Plus framework is a framework used in systematic reviews on equality to map out certain parameters or aspects of inequality. So it's place, race, occupation, gender, religion, education. One, we always have socioeconomic status, social capital. The plus is there for people to add specific context-specific dimensions of inequality, and age and disability often feature among them. We would have seen in the 3 presentations that 2 of these featured particularly strongly, namely gender or sex and place of residence, where we saw urban-rural residents, and we saw specific localities being impacted differentially by the pandemic. So the question is, and my challenge is, we should really start synthesizing this growing evidence on the impact of responses. There is some evidence, growing evidence of the impact of responses, and I'm talking about social and economic responses, such as social protection. Social protection is probably one of the most widely used responses during the pandemic and during lockdowns. But we need to synthesize that evidence so we can have a better idea of what works, what doesn't work, what are the lessons to be learned. And of course, I would not be amiss to not say something about vaccination. And we see huge inequalities in vaccination. And we see low and slow vaccination in these 3 countries. And we need to take the same lens to vaccination and to acceptance and to hesitancy, and think about how these inequalities affect these interventions. So it's more of a challenge. How can we think about responses to the pandemic in terms of inequality? And how can we think of those both in terms of benefits as well as costs? Thank you.
Thank you, Frikkie. That was a very sobering presentation, but also raised quite a lot of pertinent issues. So now it is time to open up the floor for questions. I would like participants with questions to please raise their Zoom hands. And then I'm sure Itumeleng can facilitate unmuting of the participant with the question. Okay. I see Dory's hand up first. There you go, Dory. Floor is yours.
Thank you. So I thought those were really good presentations from the beginning to the end, and big congratulations to all of you. It was really, really well done. I wanted to pick up a little bit on what Frikkie said at the end about synthesizing the findings, and one of the questions that I had whilst listening to Laura was, what would explain the differences in the findings between what you found, Miracle, in terms of food insecurity and what Laura found in terms of food hunger? In particular, it seems that the trends go in the reverse direction. So, Miracle, you found that food insecurity in Malawi food insecurity declined over the period, if I understand correctly, whereas Laura found that food hunger in South Africa increased over the period bearing the duration of the pandemic in 2020 and 2021. And it would be, I mean, it's perhaps beyond the scope of what you are doing, but it would be good to speculate what factors would account for a decline in food insecurity in Malawi versus an increase in food hunger in South Africa. I really liked, Laura, what you found about the social relief of distress grant. I thought that was very interesting, just as an aside. And then I wondered, Adiola, you're finding that female ownership was a strong predictor of firms not surviving, and that's a really important finding, which you seem to attribute largely to informality or to female-owned firms being more vulnerable. And that would be interesting to explore that further, not necessarily for this study, but going forward. I assume you're controlling for informality. So what additional characteristics of firms would account for why female-owned firms are more vulnerable? Is it less access to credit, less in reserve, the sectors in which these firms are located, for example? But I think that part of a synthesis would be, and I know it's a very big thing, but a big job, but to see what kinds of interventions were successful and what kinds of interventions or lack of interventions were really marked or not successful. Thanks.
Thanks, Dory. So I think perhaps, because there were 2 sets of questions, perhaps we can quickly address them. So Laura and Miracle, would you like to respond to Dory with regards to your thoughts on why food security trends seem to be quite the opposite in Malawi and Gauteng. Laura, would you like to go first?
Sure. I mean, it's very difficult for me to know the context of Malawi because I wasn't working on the topic. But I think in the case of Gauteng, we did see this increase in hunger, but that was actually already happened pre-pandemic. And actually, when we look at the change before and after the pandemic, you know, we do see this slight increase in adult hunger, but with child hunger, we see it almost let's say it's stayed the same. So, I mean, I think the factors that are contributing to any change in hunger in these contexts are obviously a decline in work and employment opportunities and you know, access to ways to fund food security. So I think in the case of South Africa, it's quite straightforward what the factors were that were contributing to this condition. What I found surprising, though, was the fact that hunger levels hadn't increased more between 2018 and 2021. And I mean, I think for that, we need to do some sort of causal analysis about the impact of the grants, rather than just doing this correlatory thing, work that I've presented here. And I would think that that's sort of the next step of the analysis. But I'll leave it to Miracle to talk about why she thought what the factors were contributing to the decrease in food insecurity in Malawi. And thank you, Dory, for the comments.
Good afternoon. Thank you, Dory. Thank you, Laura. So when I'm looking at Malawi, I'm seeing an environment which is largely informal. So during the early periods of the pandemic, so some individuals, for instance, we have people who rely on informal agriculture in casual labor or in informal businesses. So some of these during the early period, they couldn't access their workplaces because of the stigma and the fear of the pandemic. But now when people got used and they started to go back to work, that is why even if we look at loss of household income, it decreased over time as people were opening up back to their economic activities. And also I'm thinking that on the agriculture side, during the early days, some activities were disrupted due to the pandemic, as say some workers couldn't go to work, maybe due to the disease or due to fear of catching the disease perceptions. But after a while, people started to go back to their agricultural activities, which could partly explain why food insecurity, which is broadly measured, could have been decreasing during the pandemic. Because I'm thinking in the initial stages, it was like, were you worried that you were going to suffer from hunger, from insufficient food, non-nutritious food? So the perceptions of household members at the beginning of the pandemic could maybe have been having this grim situation such that they were even more worried, which could have maybe inflated their actual experiences. So that's my take at this point.
Thanks, Miracle. I see Dory's message that her connection was interrupted. Dory, would you like to continue with the comments?
Yeah, sorry, I didn't hear all that Laura had to say. Sorry, my internet is very unstable at the moment. But I do think that it's very interesting that people in Malawi seem to be more resilient than people in Gauteng. And I think Laura's findings for Gauteng apply to South Africa more generally, that food hunger increased nationally. And Miracle's response suggests perhaps that it's a greater reliance on farming that perhaps provided more protection to people during the pandemic, possibly. But thanks very much.
I was also wondering whether levels of lockdown had anything to do with it, whether Malawi had as severe lockdowns as South Africa experienced?
Yeah, that's an interesting question too. Mm.
Right, so we can go on to the next participant, Calvin Wudzingri. Please go ahead.
Yes, thank you so much, Chair. My question is on the first presenter. I just want to find out, I know he has just indicated something to that effect. If you compare the impact of the COVID on South Africa and Malawi and Zambia, you would see that the effect is severe on South Africa. So what I wanted just to also find out is what could be the possible causes. Is it because South Africa, the population is dense, or could it be because of the maybe per capita income that allows people also to interact and also do that and interacting so that there's a spread? Or could it be also to do with the economic activities in the countries? So I would assume that maybe in countries like Malawi and Zambia, the development is not to the level of South Africa. So that could have also maybe propagated the spread of COVID. I know the presenter also highlighted that they are not very sure, but I just wanted to find out whether there are some other people who may have an idea of why that could have been the case, that South Africa would have more cases and deaths, and also is it to do with the testing and the collection of statistics method by South Africa, and that may not be available in those countries, those other two countries. Thank you. Thank you.
By first presenter, I understand you, Calvin, you're talking about me, Ibra, or you're
yes.
talking about?
Ibra,
okay.
please go ahead. Ibra, that related to your presentation, I understand.
Okay, thank you, Uma, and thank you, Professor Uma, and thank you for Calvin. Thank you for your question. In terms of your question, if I may answer you from my understanding, apparently I haven't yet come across any study that indicates exactly what led why South Africa has much more cases in terms of causes. But from what the literature says, they actually indicate mainly it's about in terms of population, definitely relative to Malawi and Zambia, definitely South Africa has a higher population compared to both the two countries. So you would expect that the cases would actually be much more relative to the Zambia and Malawi. But also some literature or some scholars attribute the number of cases to the fact that Malawi and Zambia definitely report relatively on a lower scale, or in terms of testing, the magnitude of testing in the three countries, South Africa definitely ranks higher than Malawi and Zambia, because if we are to look at the the trend in which South Africa tests, or the number of cases of COVID tests carried out across all the three countries, South Africa has really really ranks high in terms of testing. So maybe in the short term or in the medium term, we may attribute this to testing, also the population relative to both across all countries. But ideally, or I wouldn't say conclusively that that's the main reason why South Africa has higher cases. There may be more other reasons or other factors, but right now it may be very premature of me to actually say that this is what causes what. Thank you. I hope I have answered your question.
Thank you.
Right, so we can move on. I see Marcio's hand next up.
Yes, thank you very much, Prof. Uma, for the opportunity. I have two questions, one to Prof. Miracle and one for Prof. Friki. With Prof. Miracle, we all know that one of the problem with food insecurity we talk about during COVID-19, people they had their wage reduced, short of labor, inflation, even exchange rate, and most of the cases affect the food insecurity. So in case of Malawi in South Africa, what is the proper policy to reduce this shape, to change this shape when we talk about food insecurity? And for Prof. Friki, I have one question. You talk about inequality. And one of he pointed that getting access to vaccination is is inequality. I want to know what's the macroeconomic policy that can help to reduce this inequality in those three countries you spoke.
Okay, so if I understand you correctly, Marcio, your question to Miracle was what could be the role of macroeconomic policy?
No. What's the policy that the government can come out to reduce the food insecurity?
Okay, so were there any interventions from the
Yes.
side of the government
Yes.
to address the issue of food insecurity? That would be similar to perhaps what we had as SRD and top-up grants in South Africa. Am I correct?
Yes.
Okay. So Miracle, over to you.
Thanks, Marcio. Thanks, Uma. So what I understand in Malawi is that there's some bit of social security, but it is not a full-fledged program, because what Malawi mostly does to poor people, by its rural nature, it was got a FISP program, Farmer Input Support Program, whereby they provide subsidized agricultural inputs, like your fertilizer, seeds, and so forth. So for those ones, maybe what they can do is to improve targeting, such that they can focus more on individuals who are more vulnerable to food insecurity during the pandemic, and also broaden the amount of recipients that can be covered. And also there are some bit of, say, non-government organizations that can give social security to vulnerable households. Maybe the government can do more such that the conditions will be more favorable for a lot of people who could be private individuals or international development agencies to come in and try to boost the social security service for the country.
Thanks, Miracle, for that. So the second part of the question was addressed to Friki, which related to possible roles that the macroeconomic policy could play in terms of improving vaccination outreach. Friki?
Yes. Sorry, I didn't think it was macroeconomic policy. I think it was just how do we address those inequalities? Of course, vaccination is a contested issue, so I'm not going to get into the debate about vaccination. But I want to make three observations. The first of these is that it seems that nudging and boosting people has not worked to the extent to which we hoped. And the question is whether we need, and this is my second point, the question is whether, and in South Africa, the president has hinted at this, whether we need to make vaccination mandatory, at least if you're in public spaces. The last point I want to make, and now that point has slipped my mind, but I think my observation in the presentation was about asking, we should reflect on the extent to which various types of inequalities drive these differentials in acceptance and hesitance, and then address those via appropriate means. I hope that answers your question.
Yeah, I think, so I think South Africa can be considered to be kind of an outlier in the African context, in the sense that we have access to vaccines, and it is mostly the hesitancy on the part of the residents that is responsible for the lower vaccination rate. I'm, however, unsure if the situation is similar in the other two countries, Malawi and Zambia. And therefore, improving vaccination there would need to go beyond the mandate, and I would think ensuring access and availability of vaccine, and to that extent, the role of the international community also, I think, can be raised as potential sort of intervention required in my mind. That was just additional points that I thought could be brought up here. Moving on to Jillian Murray.
Thank you. My name is Jillian. I'm with the GCRO, whose data Laura has very kindly been using for her analysis. So probably a little bit unfair to be coming in, but I do want to say thanks for the presentations, and particularly thanks for Laura's presentation. Really nice to see not only our data being used that way, but also some really insightful inputs. I just want to, I've been working on some of the food security stuff as well. So I thought maybe I can add a little bit onto the discussion. And then a question particularly to a couple of the presenters around the way we're responding. So the first is to say, I think it's very important between the two presentations to differentiate between hunger and food security. So hunger really just refers to skipping meals, and it's not the best indication of broader food insecurity. And food insecurity takes into account both the ability to access food, have regular meals, but also that food is nutritious. And in this quality of life survey, we did include a bunch of questions, and we put in a measure of food security. So we can measure both hunger and food security. And I don't know if that information has been given to the team, but I'm very happy to share if content hasn't been shared with them yet. I know it's also been very recently developed, so it might just not have gotten to them in time. So as I said, that hunger levels, adult hunger was about 25% of adults saying they have skipped meals. The other point to note is childhood hunger is lower, and that's because if there is food in a household, families are more likely to feed the children before they feed themselves. And there's also a lot of, I think we need to understand the deep human emotions that go and vulnerability that fits into hunger. And no parent or no adult wants to admit that they're unable to feed a child. So we do see a lot of underreporting on child hunger all over the place. And I do think there is underreporting on child hunger in this case as well. And I think that's important to note. But when we measured food insecurity, and in this case, what we did is we measured both hunger, access to food, and the ability to afford a really basic nutritious basket of food. Food insecurity levels in Gauteng go up to 52%. So more than half of households with the survey are food insecure during the pandemic. And it really boils down to the ability to access nutritious food and to purchase nutritious food. So the poorer you are, the larger your household, the more vulnerable the household, the higher you are to be food insecure. And levels of extreme, what we said was extreme food insecurity. So that's where there's both child and adult hunger, where there is low access to food, and where you're unable to afford a nutritional basket of food, is about 18% of households in Gauteng, which is extremely high. And the pandemic, and in an urban context, it's all around the ability to be able to buy food. And it comes back to deep levels of poverty and inequality. And so I suppose the question that I wanted to ask is, a lot of what we're talking about today across all the presentation talks about structural issues and structural inequalities and policies. And I often don't see in the way we're responding to the pandemic, and I'm referring particularly to the South African context, that we actually address or even acknowledge some of those deep structural inequalities, which have always existed, And what the pandemic is doing is just entrenching them and making them so much deeper. And I wonder if there's any way in the responses that we can start making these things a lot more clearer and being a lot more direct around some of these deeper structural issues, which I think we're not addressing in as direct a manner as what we should be doing. Thank you.
Thanks, Jillian, for those very insightful remarks. I think that's one of the objectives of having this webinar and this interactions is to get such detailed and nuanced inputs from participants, which I'm sure will go a long way in improving the final report. I think the point about differentiating between hunger and food insecurity in terms particularly of nutrition is well taken. And I'm sure Laura will look into it. But at this point, I would like to check if Laura or anybody else would like to respond to Jillian's remarks on the matter of nutrition, as well as structural inequalities that need to be highlighted.
Thanks, Uma. Yes, well, thank you so much, Jillian. I mean, I think really valuable your inputs in regards to the nuances of the data. And no, we hadn't captured food security. We just looked at hunger. And in our final slides, we do show this fact that exactly what you say, that we do see the shielding of child hunger by adults within the household. But I don't think we took into account the fact that that could be a reporting bias as well, just because it's such a vulnerable topic. And I think that's a very good point to make as well when we're looking at these reports, right? Is that there are people behind these numbers, and that this is a really tough period for a lot of South Africans and a lot of people from the SADC region. And then with regards to the structural components, yes, and we did actually, part of the report, we also look a lot, we look at inequality as well. So we measure the changes in inequality over this period of time. We just didn't present it here. But I think your point is well taken about the fact that we bring it into the results section and the discussion section. And incorporating it there. And maybe it would actually be great to at some point just have a meeting with you and we can discuss the results and compare notes. That would be incredibly useful, but I'll email you afterwards. But thank you for the very useful comments.
Fantastic, thanks, Laura. Moving on, Maxine Moyo. Maxine Moyo, I see your hand up. Please unmute if you're speaking.
Good afternoon, everyone. And also want to greet the organizers and Professor Frederick Boysen, who's my supervisor. Allow me to thank you for the presentation. I've quite learned a lot. Also made a few observations as I was listening, which I would want to share also. My observation is across the presentations, I looked at the variability in the responses made by the 3 different countries to the pandemic in terms of the speed of responses and the manner in which the lockdowns were implemented. My question is in line with the concept of global governance of public health emergencies of international concern, to say in the presence of evidence such as this, that sovereign states can implement responses to public health emergency of international concern in so much of a variable manner. Should that be a concern to structures that govern how regional entities respond to such a shock. Because fine, we see the differences between the morbidity and the mortality between South Africa and Zambia and Malawi. Those differences are embedded in the structural concerns that have been alluded by the previous presenters. And also, I want to question if the structures that have to do with the regulation of responses as a form of should I say stewardship, to say each state has got a mandate to respond in a particular manner when there is a public, an international public emergency like COVID, and so much that things should not be random. Things should not be random, but should be predictable in a manner. So this is my observation that is this supposed to be the way things are? Is there work towards improving uniformity in responses so much that variability in response does not convert into lives lost at the end of the day? But well, on a more restricted view, we see it in the health sector when we look at variability in medical practice, where too much variability in the way a treatment intervention is implemented, it tends to have a negative consequence in terms of outcome at a population level. So there's probably a need to regulate the variability in responses. I would want to think maybe be it in a local level and also in an international level when we're dealing with pandemics. So I just see that there's a variability in the way the three nations responded in terms of lockdowns. And my concern is that variability okay? Are we doing something about it? Is there something that is being done about it? Thank you.
Thanks, Maxine. I think you have highlighted a very important point, and that is the heterogeneity in terms of the response between the three countries of interest here. And both in terms of the social protection measures, also in terms of the lockdown measures, and now in terms of vaccine availability. I think these are very important points that obviously will find mention in the report.
Excuse me, Professor Uma.
Yeah.
Can I just supplement?
Point?
Yeah, no,
yes,
I just want to supplement on the previous speaker's point, right? If I understand him well, he argues that probably if the kind of response in terms of the preventive measures was regulated and all countries probably followed an organized kind of maybe script, then probably we wouldn't see the variation in cases, right? But actually, that's not the case, because if I may share my screen, just a second. If I may share my screen, can you see my screen, Professor Uma?
Yes, it's visible.
Yes, so if you look at the stringent, the COVID-19 stringency index, this measures actually how strict or how strict each country followed the lockdown measures that were set by the World Health Organization. So if we look at South Africa, right? South Africa scores highly compared to the rest of the two countries, Zambia and Malawi, and this is at 84.26, right? That means, but then when you look at Malawi is at 60 and it scores the least. Then when you look at Zambia scores comes second with 70.83. So if we were to say that probably if we regulated, if we were to say that probably the reason as to why maybe there are more cases, positive cases and deaths in South Africa compared to the other countries is probably because maybe the rate at the response rate wasn't as strict as compared to other countries, then I think this would, the current stringency index actually contradicts that. But in as much as I agree with the previous speaker, this stringency index shows otherwise, because you can see that South Africa actually followed the regulations on a more stricter rate compared to the other countries. But either way, in the long run, it still ranks high in terms of both cases and deaths. That was just my supplementation. Thank you.
Thanks, Ibra, for this. At this point, I would like to know if any other presenters would like to come in here with any response. Okay, so I don't see any response. Also, I don't see any further hands up, but this is perfect timing. We now would like to request Fricky to come in here to round up and give his observations on the question and answer sessions that we had. We had lively discussion, very important inputs, and I think it would be fantastic if Fricky can throw in some of his observations to the discussion in the last half an hour.
Thank you, Uma. I may be doing something slightly different to that. I think what has happened is that the pandemic has, to some extent, our research has been hampered or to some extent locked down, although we've collected lots of data and they're useful studies. So I want to sort of think about 4 things we need to do in understanding the responses, but most importantly in understanding the impact of those responses. And the first of these goes back to some of the questions some of the participants had about some of our results, and that is understanding the mechanics or mechanisms that explain these associations that we see. We have to probably, I guess, hypothesize about them more often than not. But I think we need to look at what explains what we find. We need to, if you want to say, look inside. We're going to have to look back. We're going to have to look back because it's the only way we will understand the impact and the policy responses. And Dori made a very good point in terms of saying that we should also study the lack of intervention, and that study.
I don't know, I have a headache and it's eating me here.
Fricky, you can continue. I think Muxini Moyo has been muted now.
Was I speaking all along on mute?
No, you were fine.
When last did you, what did I last say?
Last 20 seconds.
Last 20 seconds.
Yeah, we just lost you. We just lost you in the last 20 seconds.
So I talked about looking back.
Indeed.
And about understanding or studying the absence of interventions to learn more about interventions. We also need to look ahead because the pandemic is not done with us, I think. We need to continue to look and study and understand the longer term impacts that the pandemic will still have for many people, including the extremely poor. But we must also look beyond and this was, I think, again, Dory's point, was that we often study our little community, we study our country, we rarely look beyond that context. And we need to look beyond that context to understand our own results and be able to make, I think, more meaningful contributions in terms of what we say about policy and about policy responses. So just again, you know, we need to continue doing the good job we're doing about understanding the pandemic and the response, but we need to be doing more. Thank you, Uma.
Thank you, Frikkie. So lastly, now I would like to invite Imran Valodia to give his final observations and the vote of thanks to wind up this event.
Right. So can I just say how kind of enjoyable that the last 2 hours and a bit kind of have been. Before closing, I did want to just share three thoughts. The first is it does seem to me that we have a kind of pretty kind of exciting and kind of unique opportunity that comes out of the work that's been done today. As a number of you have pointed out, we have a kind of interesting set of things that are not consistent across all of the countries that have been studied here. We kind of also have a kind of really exciting opportunity in that people have looked at different data sets and that there are kind of others in some of the countries that have been looked at that have not been examined. So to take the kind of example of South Africa, we've got the work that Laura's done with the GCRO data. There's the HSRC data. There's the NITSCRAM, and I think there's a kind of really exciting opportunity for people to sort of look at the different surveys and for us to get a bit more precise about what of all of these kind of impacts. And let's be clear, we're living through one of the biggest shocks in our time. What is it that we have confirmed across all of the different data sets? Where are there sort of serious kind of issues of inconsistency? Where are there puzzling and interesting questions? So I think some work across that issue would be really important. Two is, I mean, I think maybe the gaze that we need to be putting to these kind of questions now should be as much about the impact as having to think about as kind of having to think about the recovery. So what seems clear from what the health kind of experts say is that we are going to have to be living with this problem and with this pandemic for years and years, and the type of drama that we've seen in South Africa in the last week is kind of something that's going to have to become the norm, and living with the pandemic and kind of adapting our economic lives to that reality seems to me to be quite clearly something we have to think about. So the focus of this work has been kind of really on kind of understanding the impact of lockdown, etc. But I think there's some interesting new kind of ideas that have emerged in the papers and in the discussion about this kind of question of recovery and living with the pandemic. My third and last comment is I think as kind of a kind of issue that I get quite worried about in South African kind of economics, especially, is the lack of conversation between people who work on microeconomic issues and people who work on macroeconomic issues. I think it's almost like those two groups talk to each other, but hardly ever talk kind of across that macro micro divide. And kind of again here, I'm kind of especially and encouraged that there's some of that sort of conversation happening. So with that, let me thank you all for participating in the discussions this afternoon. Let me thank you for the presentations and the papers. Thank you to the SCIS team who managed the project and managed this event. And thank you all for the discussion we've had. So with that, I think let's close the event. Keep well, everyone, and keep safe.